Michelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place to get evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Today we're going to be talking about natural ways to help support your symptoms if you're having PMS type symptoms or PMDD type symptoms. Okay, so typical symptoms: PMS, PMDD, irritability, breast tenderness, cravings, sometimes difficulty sleeping, cranky.
Yeah, and they're not the same thing, right? Like
Right.
PMS is just this really mild form of premenstrual symptoms that can go on. It could be physical, like breast tenderness, bloating, or it could be mood changes, anxiety. PMDD is like pretty severe symptoms to the point where it impairs your ability to function. They're really distressing. It kind of messes up your life.
Right, so we're not saying that they're the same thing. We're just saying here are some of the things that you can do maybe if you suspect that you have these things, in addition to talking to your doctor about additional symptoms or additional treatment options.
Yeah, if you're interested in some natural ways to treat it. So the first thing that probably has maybe more evidence than some of the other natural ways, although it doesn't have a ton of great evidence, is taking calcium 600 milligrams twice a day.
And I think there's very little evidence to support that that is going to be harmful for very many people. So, take some calcium for a while and see if maybe that's helpful for you.
Yeah. And I think something to say before we kind of go through all of the treatments is that it's helpful to start one treatment at a time so you can see, does this help? If it's not helping, don't take it, because everything you take, even if it's natural, can have side effects, and so no point in taking it if you're not going to get benefit out of it.
Sure, yeah. The thing I tell my patients is like, if we throw 8 things at it and you're feeling better, and then you start feeling worse again, how are we going to know what to do next?
Yeah.
Right, so really just like try to focus on one thing. What is another option? Chasteberry?
Chasteberry has more evidence around it in being helpful for breast tenderness in the premenstrual time, but there's some research on maybe it being helpful for PMS. PMDD, it's kind of hit or miss.
Right, so I would say like it's not conclusive evidence that it's going to be helpful for PMDD, although I don't know of any evidence that it's harmful to take it.
Yeah, it has very few side effects. So again, one of those things you could try it and see if it works for you. For the dosage, it's like a pretty wide range that you can take. I think anywhere, most studies, it was like 20 to 40 milligrams a day. So throughout your menstrual cycle, or throughout your every day.
Every day, all your life.
Take it. Up to
1,800 milligrams a day.
1,800 milligrams a day. So
maybe we're not doing that, but
yeah,
just like
maybe start with 20. See how it goes.
Okay, so kind of in general, not specific to PMS or PMDD, would be magnesium. We use it a lot for like sleep initiation, anxiety. I think just overall like
being calm and relaxed.
Yeah. I always talk to my patients about using magnesium glycinate instead of magnesium citrate, because magnesium citrate is a laxative.
So is magnesium oxalate.
Oxide? I don't know. Magnesium.
Just stick with magnesium glycinate. That's the one that goes mainly to your brain. It still can have some GI side effects, and then it may give you some loose stool going on, but
not like citrates.
Yeah, no,
for sure. Usually recommend starting at 100 milligrams, and you can titrate up to 400 milligrams at bedtime and see if that's helpful.
Yeah, sometimes I'll have my patients take it like 3 times a day too, so you can again start at like 100 or 50 milligrams 3 times a day, and you can go all the way up to like 200 milligrams 3 times a day. It is one of those supplements that you don't want to take too much of, so I wouldn't like go crazy with it, because you can overdose on it.
And then magnesium plus B6 is another one of those things. I think they like work in conjunction with each other. So B6, I think it's like, this might be wrong, 50 milligrams So there's also some evidence for light box therapy that like maybe in the PMDD, you know, kind of constellation of symptoms that there's some dysfunction of the melatonin something, we don't know really. So light box therapy would be using 10,000 lux of light, basically like, you know, if you're getting ready in the morning or whatever, you put the light box there, you have it about 3 feet from your face, you use it for about 30 minutes. But you want to be careful with that one, that we don't like to use light box therapy for someone who has bipolar disorder because it might mess up their cycle.
Well, yeah, in bipolar disorder with light box therapy, it can induce like mania or hypomania symptoms. So if you are using it, you want to kind of like start it out at less minutes per day and kind of slowly titrate up.
Yeah, I would definitely just recommend talking to your psychiatrist or your primary care doctor about starting it before you do, in case that's something they're worried about for you.
Right.
Other natural things, therapy, medication, not medication, therapy, diet, exercise, reduction in caffeine, reduction in alcohol, just kind of the general things that we recommend for health overall anyway.
Yeah, and actually cognitive behavioral therapy has a lot of good evidence for helping to treat PMDD in particular, so, you know, I can't say enough about therapy. Therapy is always great.
Yes. I love therapy. Okay, so a couple of supplements you could potentially try: light box therapy, regular therapy, diet, exercise, caffeine, alcohol reduction. Sums it up.
Yeah. Good luck.
Thank you for being here. Please like, comment, subscribe, share with your friends. We'll see you soon.
Bye.